All right. So for the next disease which we'll be discussing, its peculiarity if it occurs in children, is a Kawasaki disease. Kawasaki disease. So you see a whole lot of diagnostic features of the Kawasaki disease. Coronary artery aneurysms, swollen lymph nodes, the eyes are red, peeling skin. The tongue is red, it's cracky, it's dry, swellings, and that's edema, and all of that. So Kawasaki disease. So first of all, you should just know that it's a rare, it's an inflammatory condition. It affects children, especially children that are under the age 5. It causes inflammation in blood vessels throughout the body, especially the coronary arteries which supply blood to the heart. So early diagnosis and treatment is very important. Do you understand? So what is it? It's a mucocutaneous lymph node syndrome. Kawasaki disease is a form of vasculitis, inflammation of blood vessels. So it's actually the leading cause of acquired heart disease. So you get a heart disease from Kawasaki disease, and this heart disease, you aren't born with it. You got it as a complication of another disease condition. You understand? So who is at risk? Who is much more vulnerable to having this Kawasaki disease? So mostly children between age 6 months to 5 years are mostly affected by Kawasaki disease. Sex, slightly common in boys. Geography, there's a higher incidence in Asia, Japan, Korea, Taiwan. Seasonality is more common in the late winters and early springs. Kawasaki disease. So key symptoms: the child is having a lot of fever lasting more than 5 days. The eyes are red, the lips are red, cracked, strawberry, swollen hands and feet, rashes appearing on the trunk, genital areas, swollen lymph nodes, especially in the neck. So other symptoms is irritable, belly pain, vomiting, joint pain. So that's just it. So good image for you to actually pick up the symptoms of this Kawasaki disease. Swollen lymph nodes, I can see it here. The tongue is red, strawberry is cracky, I can see it there. The eyes are red, swollen legs, the skin is peeling. So you can easily just pick everything. Alright, so let's move. Diagnosis, there's no single test, right? So you just want to pick up that the fever is there, and at least those symptoms that I listed here, you want to pick them up, just like I picked them up from this picture. Then exclude other diseases. So tests may include echocardiogram to check coronary artery involvement. You do blood tests, just to check out for all these inflammatory products. Then urinalysis. All of that will help you to rule out. So treatment is what? Intravenous immunoglobulin. It will reduce how your immune system is trying to fight the body's own tissues. Aspirin to treat anti-inflammatory, corticosteroids. Then children should always be monitored for complications in the heart, not to actually get too worse. So that's it for this.